Hi, welcome back. I am Fatima, and today we are going to dive into one of the most chilling true crime stories in modern history. This is a story of a man who took an oath to save lives, but instead went on to take away hundreds of them. This is Dr. Harold Shipman, also known as Dr. Death. Harold Frederick Shipman was born on 14th of January 1946 in Nottingham, England. He came from a working class family where his father, Mr. Frederick Shipman, worked as a long distance lorry driver, and his mother, Mrs. Vera Shipman, was a religious woman who was very close to her son Harold. Harold was the second of three children, and it was mentioned that he did well in school and happened to be athletic and was even part of the school's rugby team. His friends would describe him as a very active person in the field and very fast and agile. But then off the field, he is described as a very quiet child. At the age of 17, unfortunately, Harold lost his mother to cancer. During her illness, Harold had a first-hand witness of the use of morphine in easing his mother's pain. This is a memory that would later on resurface in his career. One of his friends made mention of his reaction after his mother's death. Apparently, he had met with Harold on Monday morning and they kind of were asking each other how their weekend went, what did they do, the activities they've done and so on. And he told him his own activities over the weekend, and then Harold went on to tell him that he lost his own mother. So his friend felt bad for him and was trying to ask him how he is feeling or how he felt about it. And Harold went on to tell him that he went out for a run at 2 a.m. in the morning in the pouring rain, end quote. Following his mother's passing, Harold decided to pursue a career in medicine. He went on to enroll in Leeds University, where he graduated in 1970 with a bachelor's degree in medicine. A few years later, he got licensed to work as a doctor in the UK. Everything went well up until when his career had its first hurdle. In 1975, working as a GP in a small town of Todmorden, Dr. Frederick began to illegally prescribe himself large doses of a painkiller known as pethidine. He became so addicted to it that it was even unknown to the people around him. So apparently, pethidine is a type of painkiller that is prescribed during childbirth. So his addiction was unknown, and at some point in time, he happened to have seizures and so on, to an extent that on a particular day, he collapsed. He didn't show up at work, and his friends happened to find out that he wasn't at work, and they kind of did a follow-up to check up on him and to know what was going on. And upon arrival at his home, they found him unconscious. So he was rushed to the hospital, and the doctor revived him, and he was later on diagnosed with epilepsy, and this deemed him unfit to drive. So his wife voluntarily opted to be driving him to work and back home. So he continued to do this for a while, and eventually he got caught. He was fined £600 and was sent off to a rehabilitation program. So after he was done with rehab, he came out and he was let off with a warning, and he eventually went back to working. His license never got revoked. So in March of 1975, one of his patients, Eva Lyons, died a day before her 71st birthday. So he went on to continue with his practice as usual. In 1977, he began to work with Donnybrook Medical Center, where he became well-liked and trusted by many of his patients. He went on to garner as many as 3,000 patients whom were registered under his panel. Most of these patients happened to be elderly women or elderly persons. He continued to treat different patients for the next 2 decades. In 1991, Dr. Shipman decided to start his own medical center, which was known as the surgery. It was located at 21 Market Street. He decided to move over there and he took his 3,000 patients along with him to his new place. So everything went well up until 1998. On 24th of June 1998, Mrs. Kathleen Grundy, born 2nd of July 1916, passed away at her home in Joe Lane, Hyde, outskirts of Manchester. Mrs. Grundy was a former mayor in Hyde. The 81-year-old lady was well respected and known for her involvement in different social activities. 2 days before her demise, Hamilton's solicitors received a will that was supposedly typed by Mrs. Grundy. And mind you, Mrs. Grundy had never worked with Hamilton's solicitors before. In the will, it stated that her estate of worth £300,000 had been bequeathed to her doctor, Dr. Fred Shipman. 8 days later, the Hamiltons yet again received another letter informing them that Mrs. Grundy had passed away. So upon getting this information, this letter, they went on to contact Mrs. Grundy's daughter, Mrs. Angela Woodruff, to inform her about the will they had in hand. This was bizarre to Mrs. Woodruff as she herself is a solicitor and she already had a copy of her mother's will that was written 10 years prior to her death. Mrs. Woodruff, alarmed, decided to travel from Leamington Spa to Hyde to meet up with the people that had in fact witnessed the said will. One of the witnesses was Paul Spencer. Mrs. Woodruff met up with Paul and she had a shocking discovery. Paul Spencer gave her detailed information of what had happened and what had led him to being a witness on the document. So he went on to tell her how he and another lady that was seated next to him in Dr. Shipman's surgery was called in to ask if they wouldn't mind being a witness to a document. So Paul said that he went into the office, into Shipman's office, and upon entering the office, he met an old lady seated in a chair. So Dr. Shipman went on to ask her if she's okay with Paul signing on the document, and she said, yeah, it's fine, he can go ahead and do it. So Dr. Shipman went on to give him a document that was folded over, and he happened to show him where he was meant to sign. So Paul made mention of seeing that on the document there was a signature that was there already, and that signature happens to be that of Mrs. Grundy's. So he went on to sign on the document, and that was it. So apparently, Dr. Shipman told Mrs. Grundy that she is participating in a research for Manchester University on aging, basically a research for old people. And that was why she consented to be a part of it. With all this discovery, Mrs. Woodruff went straight to the Leamington Spa police station, whom then referred her complaints to the Greater Manchester Force. So her case file was given to Detective Sam Edgerton. Detective Edgerton went on to speak with Mrs. Woodruff, and upon having a whole conversation with her, he found out that that wasn't the first time the police were showing interest in Dr. Shipman. So apparently, 4 months prior, a GP got concerned with the high number of deaths in Shipman's patients. So she decided to report it to the local coroner, John Pollard. So John Pollard decided to launch a secret investigation where the police were investigating the activities that were going on, but secretly without having them know what was going on. And not just the concerned GP. The funeral home, Frank, Massey and Sons were also concerned. They even went on to go and meet with Dr. Shipman in his surgery to talk about the high number of deaths. So he went on to bring out a register that had recorded the number of deaths and the causes of deaths and everything, and he somehow convinced the owner of the funeral home that everything is fine, that whoever is having any kind of doubt can always come and look at the register, the book that he used to register the deaths. So they were convinced at some point and they let it go. And along with that, the police investigation also didn't find anything unusual, so the investigation got closed down. Exactly 1 month after Mrs. Grundy had been buried in Hyde Chapel, Inspector Edgerton got an order for the exhumation on August 1st, 1998. He, Mr. Edgerton, and 10 other men at 3 a.m. in the morning began to dig up the grave. Whilst all of that was ongoing, there are a team of detectives that were searching Dr. Shipman's home and office, his surgery, looking for the typewriter that was used to draft the will. So Mr. Shipman knew what they were looking for, so he decided to give it to them himself. So he went up to a cupboard in his surgery and he brought out the typewriter and handed it over to the police. With all of this ongoing, a taxi driver came forward with a list of 24 of his customers that had passed away shortly after meeting with Dr. Shipman. So with this information, Detective Edgerton knew he had so much at hand, and this gave the investigation an entirely different turn. So they went on to exhume more bodies, and they had successfully exhumed 15 more bodies. So the toxicology report came back for Mrs. Grundy, and it was noted that there was a high dosage of diamorphine in her system. This is an amount large enough to kill a person within a couple of hours. With this at hand, the fourth victim that was exhumed was Bianca Pomfret. Bianca Pomfret was a 49-year-old divorced woman who suffered with manic depression. She died on 10th of December 1997. During the time she was alive, she had built a close relationship with Dr. Shipman to an extent that she decided to give up £60,000 of her belongings, of her property, to Dr. Shipman. But fortunately enough, her ex-husband, Mr. Pomfret, knew about it because several months before her death, she told him about it, and he was able to convince her not to leave her money and property to Dr. Shipman, but instead to her grandkids, and she went on to do just that, fortunately. Bianca Pomfret happens to be the youngest amongst his victims. So the investigation went on and his computer was being examined. So in his computer, it was noted that some of his patients' history were tampered with, some were cleared off, some were, there were like addition in what was wrong with them, like there is change in their diagnosis and a lot more. And also there is a particular patient that had their death recorded before the time of their actual death. And there is another patient information that was tampered with after their death. So his computer alone had recorded a number of 171 women and 44 men that died from his surgery alone. So there is a big question as to where and how he had obtained the amount of drugs that he had been using so far. So a former airline pilot, Jim King, was wrongfully diagnosed with cancer shortly after marrying his wife, Debbie. He went on to undergo chemotherapy for 3 months, and later on, Dr. Shipman found out that Mr. King didn't have any cancer, but he hid the truth from him. He went on to continue to prescribe large doses of morphine so that he can keep up with his supply. This went on, and unfortunately at some point in time, Mr. King got addicted to morphine. This became concerning for his father, whom didn't understand the treatment that was going on in his son's condition, and then he decided to go up to the surgery and confront Dr. Shipman about his son's health. So he kept on asking questions, and Dr. Shipman got tired of his complaints and his questions and went on to murder him on Christmas Eve of 1996. So it was mentioned that between 1992 to 1998, Dr. Shipman was able to obtain 24,000 milligrams of diamorphine, and this is mentioned that this amount is enough to kill at least 720 people. In 1997 alone, he had killed 37 people. Dr. Shipman was arrested on 7th of September 1998. He faced trials in October of 1999, and in January of 2000, he was found guilty of the murder of Mrs. Grundy, as well as the murder of 15 other victims that took place between 1995 to 1998. Although he never admitted to any of the killings, he was still sentenced to 15 years consecutive life imprisonment. On January 13, 2004, just a day before his 58th birthday, Dr. Harold Shipman died by suicide in Wakefield Prison. He hung himself in his prison cell. An official inquiry led by Janet Smith had concluded that Dr. Shipman was likely to be responsible for at least the death of 250 of his patients. This made him one of the most prolific serial killers in history. To this day, the legacy of Harold Shipman is one of pain and distrust. His case led to sweeping reforms in UK's healthcare system and the use of controlled drugs. His crimes shocked the world and forever changed how we view doctor and patient relationships. He left us with so many questions like, what led this man to this heinous act? Was it the desire for control, or was it a twisted act of mercy, or was it just for greed? The answers might have died with him, but his story serves as a stern reminder as to the potential darkness that could exist within the most unexpected persons. Now, this brings me to the end of this horrific story. There is a lot going on. It is a sad one, and unfortunately, his case had actually brought about so many debates when it comes to euthanasia. This is a procedure that is legally used to end the suffering of a patient, but with the case of Dr. Shipman, it became very turbulent, and a lot of people feel uncomfortable talking about it, and even the doctors are not comfortable talking about it or discussing about it or counseling about it in general. So yeah, this had brought a huge dent in trust that exists between a patient and a doctor. Also, I would say that he would have been stopped a long time ago if GMC had revoked his license. But given the fact that he kind of like came off as a reformed person after the rehab, probably that gave them the idea that he is fine and doesn't need to go for any further psychological evaluation or to have someone to watch over him closely. But that had already happened. Nothing can change. And also, I will talk about how he kind of like unalived himself a day before his birthday. I'm like talking about like karma. His first victim actually lost her life a day before her own birthday. So I'm like, at least like he might have felt what she had felt at the time. But yeah, he is a horrible person, and there isn't any kind of explanation that would justify the things he had done. Whether be it he had a trauma, or he is piquing his patience, or he is just doing it for greed, we still don't know, and we won't know about it. So thank you for being here. If you've reached to this part, I really appreciate your support, and I really appreciate having you all here. Thank you so much for being here. I would love to know your thoughts and comments on this one, and have a wonderful day. I'll see you in my next one. Bye.